Yeah, it's already
Yeah.
2:20.
We plan to meet at a certain time, and then it's usually like an hour to an hour and a half later when we actually start to get things done.
It's just we just want to hang out.
We just want to hang out. So we're in the middle of this production journey for our Tell Us Story Hive series. We're producing 8 episodes for Tell Us Story Hive, but we're limiting the amount of time for each guest because we have so many great guests. And we recently had a conversation with Leah Horsfeld from Community Futures.
Yes, we did.
And editing audio is so hard when you have to cut out good stuff.
Yeah.
And she
had a lot of great things to say.
Yeah.
And she's a great speaker too, so nice to listen to.
So there was an extra segment that I just couldn't bear to delete.
No.
So I cut out like an 8 to 10 minute segment, and we're publishing it here on YouTube early as a teaser to the rest of our conversation.
Right. And these are great. This is a great segment because it
on
really
its own
has a couple of amazing projects that CF is partnering with in our community that is going to make a huge impact for people.
For sure. Yeah. So let's just get into it. I could talk about this conversation all day, but let's just switch over to the episode and enjoy.
I want to go. It was another project you guys are working on that I wanted you to kind of go into really quickly. Was with new people coming to Vernon, getting jobs, finding homes. One of the other obstacles is healthcare and getting a doctor. But Community Futures has also come up with a cool plan of getting doctors into our community. So let's just kind of go over that project.
Yeah. So it goes back. It started as workforce housing. So our board, through their wisdom, said, let's look into workforce housing. How can workforce housing work? So I deep dive. I go and try and figure out how does it work with workforce housing. And what I learned was typically with workforce housing, the rub is if you lose your job, you lose your housing, right? Because it's often tied to a position, it's tied to a job. Or you can create housing where places like Kaltai or Tolka, whatever, rent that from you or lease it from you. It just didn't feel right. And so then I learned about the brand new medical family practice residency program that UBC has approved for our region. And that has 4 family practice residents come for 2-year residency to our community to do their residency. And at the time, the coordinator said to me, I think I'm going to have to set up travel trailers in my driveway. I have no idea where these folks are going to live. And for me, I thought, oh my gosh, this could solve a couple of problems. 1, we could, house these residents. 2, we could date them and court them so they never want to leave. And so I went
Give
around.
Give them a community hug too, right?
Oh, they're getting a bear hug. Yeah. And so I started looking at properties, and the problem with that was that 4-plexes or 6-plexes, people were living in them. And there was no chance that Community Futures was going to evict anyone in order to put medical residents. That's not on. And so we found an incredible developer in the community who said, leave this with me. So they came back to us and said, listen, we've been in the development process with the city for almost 2 years now on this property in Central Vernon. We're willing to work with you and sell you this property, and we'll build it for you at an incredibly discounted rate, crazy amount of discounted rate. And so we worked with them and we modified their plan to create 2 houses that have main floors and suites, and then purchase the smaller house that was on the same lot. So we're now able to house all 8 of the medical residents on one location, and support them through the 2 years of their residency. And that will turn over, obviously, when new residents come in. And then, take that a step further. It's great that we're housing these folks, and it's a really important part of our workforce. But then we worked with Okanagan College because they have capstone projects at Okanagan College in their 4th-year business program. So if folks don't know about that, and you're a business, you want to tap into that resource because they're often looking for projects. So we approached the professor and said, what about a retention strategy for these residents, these medical residents? What are best practices around keeping them? What's best practices around like what they need in order to stay? And so our team worked with the students who created a company that kind of did this, and they presented us with this fantastic strategy. We worked with UBC, as like the UBC Faculty of Medicine as well was part of the project. And so we've initiated some of that strategy already. We've given them a community tour. We've given them welcome baskets when they came. They're doing barbecue nights. They're doing all kinds of social things. I'm trying to connect them with JCI, but apparently they're really, really busy as residents and have no time for that.
And JCI can be busy as well. Yes.
Yes. And so, yeah, we're implementing this strategy as we go along. And at the end of the day, it's really hard to attract a skilled workforce. If it's hard to find housing and you'll never get a family doctor, 25,000 people in our community without a family doctor, it's really hard to attract that workforce. So that's the angle that we're looking at from an economic development standpoint. And so then our last walk-in clinic closed in our community. And so community rallied. Community who normally isn't involved in any way in the healthcare system brought folks around a table. How do we solve this problem? What is the issue around the... And so we learned a ton. I'm learning to speak healthcare now. And we learned a ton about the rubs and the challenges that healthcare has and the difference between a for-profit model and the IH model. And so we did some consultation in the community. We talked to doctors and we talked to nurses and we talked to everybody we could who said, there is this model called the Community Health Center that is funded through the Ministry of Health. And we said, what? What is this? So then we went out to Kamloops and Penticton and we went out to Kelowna and we saw these clinics that are run by nonprofit organizations that contract doctors and hire nurses and have this team-based approach to healthcare. And they work for the nonprofit. They don't work for the Interior Health. They don't work for the Ministry of Health. They work for the nonprofit, essentially. And so we, as a community, put together an application. Community Futures was the lead. And we worked with the faculty of UBC Medicine who said, hey, this might be a really great training ground also for our residents. Then we talked to the residents and said, hey, is this model something you would want to work in when you're finished? And they're all like, yep, sign me up. I'm not interested in starting a family practice. I'm not trained to be a business person. I don't want to hire staff. I don't want to deal with the overhead. So this model allows them to be doctors and go home.
Wow.
And work with a team because it's a team-based care approach. So we have submitted that application, that massive beast of a proposal to the provincial government. And we met with them this week and they love it.
Wow.
But as you all well know, we are in the throes of a provincial government. And so it's like time out, full stop, nothing happens.
Right. Yeah. Right.
So,
to be continued.
Well, and in all truth, I think the outcome of the election will determine whether or not this happens in our community.
Okay, so 25,000 people in Vernon don't have a doctor. That blew my mind, that stat. That's crazy.
Yeah.
That's crazy. That's just Vernon. I don't know what it's like. Is it that bad everywhere else? That's insane.
What's cool is that Community Futures is doing something about it.
Yeah. Yeah.
Right?
Doctors in residence and that nonprofit medical clinic is an excellent idea. Excellent idea.
It's a model that she said she pulled from other places in the Okanagan and in Kamloops. So it'll be really cool to see if this actually works here in Vernon and we have more medical support back for our residents here.
Oh, I just thought of another question I would have asked, and that is, how many doctors does it take to service 25,000 residents?
I mean, we could do some quick math, like divide one doctor. I don't know how many one doctor would
that's
see.
what I don't know. Like how many patients can one doctor have?
Yeah.
Is that like a light bulb comment? How many doctors does it take to screw in a light bulb?
I was going to make reference to like TV medical dramas and we're like, But I don't think that's going to hit the mark either.
I don't even know how many doctors actually we already have in Vernon. That'd be interesting to know.
It'd be interesting to know. But interesting conversation.
Medical trivia.
Happy to share this conversation with you to see what Community Futures is up to in our community. And stay tuned because we've had so many more great conversations. And in the coming year, we're going to continue having a lot of great conversations.
It's going to be a crazy 2025, I tell ya.